is Women's Health Month, a time for women everywhere to prioritize their own physical and mental health.
That's right. Channel 7's Ashley Lunningham sat down with a healthcare provider to learn how to put your health first, and she joins us now live here in Little Rock. Ashley.
Yeah, Chris and Beth, oftentimes we put our health on the back burner when we're trying to juggle life. But I spoke with a healthcare professional who says starting that conversation with a doctor could benefit your health in the long run.
For the month of May, women's health is in the spotlight, but with the demand of everyday life, it's hard to make time for a checkup. So, where do you start? Dr. Jheanelle Dawkins with Baptist Health says the first step is to come in.
Usually, if the patient is less than 30 years old, there's different things that, this is for really all people. We screen on, when is your last vision exam, when's your last dental exam, any smoking, alcohol, drugs, we go into that, what are we doing for diet and exercise, we talk about that.
Dawkins says the type of screening is different for each woman, who all individually have their own needs. And she says the earlier you start the process, the better.
Age of 21, we want you to start getting your pap smear, okay? We usually stop when you're in your 60s, okay? And then after that, colonoscopies, they change from 50 to the age of 45, but if you have family history, depending on the ages in your family history and the significance, we have to screen a little bit earlier. And then in mammograms, we start at 40, and we do those every year.
Dawkins says it's not always about what you can see on the outside.
And sometimes I see where somebody comes in and they're physically healthy, right? All the numbers look perfect, but mentally they're not. So until we address every single aspect of health, you won't be living your best quality of life.
And she says she sees it often. Women are great at caring for others, but oftentimes forget to care for themselves.
99% of the time, most women are not spending time with themselves. It's that self-care, it's that self-love, it's that, what are you telling yourself when you look in the mirror? Who are you to you? Like, where is your connection circle? So we go back to those things, and how do we reconnect with ourselves?
And she says getting screened or a regular checkup, even before you show symptoms, can make all the difference.
We want you to take care of yourself. We want you to do this screening test. It's called a screening test because we don't want you to have symptoms. I want to keep you living the best quality of life that you want to live. And the earlier you catch something, even if something is there, the earlier you catch it, I'm telling you, 9 times out of 10, we can help you much better than if we catch it at a later state.
She says fear is one of the main culprits that keeps people from getting screened. But she says don't be afraid and come have an honest conversation with your doctor about your health. On your side, in Little Rock, I'm Ashley Lunningham.
All right, Ashley, thanks a lot. And if you have a family history of breast cancer, you should start getting mammograms even earlier than 40.
Well, so